Thanks very much, Wayne and delegates. It's been 3.5 years since I last stood before you and spoke about Labor's vision for a health system for all. And since then, we have had one hell of a fight on our hands. On every front, our Conservative opponents have sought to pillage and plunder our healthcare system, cut after cut after cut. Their cuts have been as relentless as they have been predictable, because we know that they do not really want a health system for all. They want a health system for the rich. They want an Americanised, a privatised, user-pays system in which the wealthy get world-class care and everyone else misses out. They have done some damage. They've cut billions of dollars from our hospitals, meaning Australians are languishing for longer and longer in emergency departments and on elective surgery waiting lists. They've cut billions from Medicare, forcing up the cost of seeing GPs and specialists. And the cost of private health insurance has gone through the roof because they can't bring themselves to rein in the big insurers. It's not as bad as it would have been without Labor. By being a stable, united opposition, guided by our values, we have blocked many of their worst proposals to cut $57 billion from our hospitals, to introduce a GP co-payment to force up the costs of medicines, to cut dental care for our children. But stopping the Liberals is not enough. We can't do what we want from opposition. To deliver our vision of a health system for all, we need to reclaim government. We want to govern so we can realise our vision of a health system that is truly universal, affordable, accessible and equitable. A system in which everyone in Australia is treated based on their needs, not on their capacity to pay or where they live. We are the party that invented Medicare. We are the party that invented the pharmaceutical benefits scheme. We are the only party that truly believes in our very core in the principle of universal health care. And we've done more than any other party to advance that cause. The last time we were in government, we continued this great work, delivering the most significant health and hospital changes since the introduction of Medicare. But our mission is not over. We have a bold agenda for government. Yes, we have to undo the damage of the last 5 years. We have to restore funding for our hospitals. We have to lift the Medicare freeze, and we have to get soaring costs of healthcare under control. But we have to go well beyond that. This chapter lays down the principles that will guide us as we build on our significant achievements. We must ensure that the most disadvantaged, the most marginalised, the most vulnerable people in our communities have the same health opportunities as the rest of us. We must take strong action on the social, economic, environmental and cultural determinants of health. We must put prevention back at the heart of our health system so people don't get sick to begin with. We must work alongside, in partnership with Aboriginal and Torres Strait Islander peoples to close the gap in life expectancy and other indicators for health and well-being. We have to lead on reproductive health so all women have access to safe and affordable terminations, and I want to acknowledge the advocacy of Labor for Choice. We have to continue to take steps towards universal dental coverage, building on Tanya Plibersek's creation of the Child Dental Benefits Scheme. And we have to innovate on primary care and come up with new models that are fit for the 21st century. Friends, rest assured, health will be a top priority for us in this upcoming campaign and if we win government, because it is core business for all of us. There is nothing more important to us, no mission more critical than delivering a health system for all. I commend the chapter to conference.